And with that, I'm going to introduce Dr. Addie Reinhard tonight. We have partnered with Dr. Reinhard and MentorVet a few times in the past, and it's always been wonderful. So thank you, Dr. Reinhard, for being here with us again tonight. Dr. Reinhard is the founder and CEO of MentorVet, which is a rapidly growing entity that leverages evidence-based approaches to empower individuals to thrive within veterinary medicine. Dr. Reinhard is a veterinary well-being researcher, and her research focuses on developing and evaluating innovative interventions to support mental health and well-being within the veterinary profession. Dr. Reinhard is also on the research team for the Merck Animal Health Veterinary Wellbeing. So lots of great research going on. You're doing wonderful work for the mental health and well-being of the veterinary industry, and we're super supportive and happy about that. So thank you. And with that, I'm going to pass it off to you, Dr. Reinhard.
Thank you so much for the great introduction. It's such a pleasure to be here with you all tonight, talking about a topic. This is, I think, my favorite topic to talk about, which is burnout, just because I know how common it is out there. And I've also experienced my own burnout a couple of times pretty severely. And so this is a topic that's actually pretty close to my heart as well personally. And I think that there are things, and the good news is there are things that we can do to reduce or mitigate burnout within the profession. It's not an end point by any means. And there are lots of things that we can do to support ourselves and others. And so that's what we're going to be talking about tonight, is really starting to understand what is burnout. And we throw around this term a lot, but really conceptualizing burnout, how to identify it within others, within yourself, especially when you're thinking about your role in the industry as a supporter. So we support animal health and we support clients, but we also support others in the profession. So how can we, as mentors, also identify and address burnout? So to give you a little bit of background on how I ended up here doing this work, it has been a journey. So I graduated in 2015 from UT Vet School. I did small animal private practice for 4 years in the Central Kentucky region. So practiced in and around Lexington for 4 years full time. I'm not an equine vet, even though I do live in Lexington, but I am a sight hound lover. So a different kind of racing animal. I have a greyhound, and anytime any kind of sight hound comes into the clinic, I just freak out because they think they're so adorable and they look like alien dogs, and I love it. So I practiced for 4 years. I did mention I have experienced burnout a couple of times in my early career. My burnout was related to, I did practice in rural Kentucky, so I had a lot of strain and stress around clients not being able to afford the treatments that would help save their animal. And so that caused a lot of stress for both me and the clients and the patients, and those ethical situations over and over again without having the tools and resources to know how to manage that stress. As well as a lot of other factors like overworking myself and not setting good boundaries. And all of that eventually led to my burnout. And so remember at 3 years out, stopping in the Walmart parking lot and just breaking down. And I called my mom and I said, why do I keep doing this to myself? Why do I keep giving and giving and giving until I have nothing left to give and completely burning myself out? And so at that point, I really started advocating for myself and setting better boundaries and trying to take better care of myself so that I could take care of my patients and my clients. And through this, I started being more open about talking about my experiences with burnout, and started realizing that a lot of others in the profession were also experiencing similar feelings, especially a lot of my classmates from vet school, and started recognizing that there was this big gap in resources and support for veterinarians, especially with regards to mental health and well-being. So I got to the other side of burnout successfully, and then I quit my full-time job in 2019, and I went back to school at the University of Kentucky, and I got my master's in community and leadership development. I spent 2 years researching veterinary well-being, and then more specifically, what can we do about it and how can we help vets? We piloted the first iteration of the Mentor Vet program, which is a mentorship and professional development program for young vets who are less than 5 years out. We piloted that in the summer of 2020, so right at the start of the pandemic. It was wild times, but we had some really exciting results, and really we're seeing that this program had the potential to prevent some of this early career burnout from getting worse over time. So one of my research mentors connected me with leaders at Merck Animal Health, and they learned about the program and wanted to help support it in whatever way possible. So they became a founding sponsor of MentorVet in the spring of 2021. And from that point, I started working full-time on MentorVet to grow and expand this program. And we had 75 young vets go through the program in the fall, another 140 go through this spring, and then we have about 200 going through our 6-month program this fall. And I'll tell you all a little bit about MentorVet later. But it's just really been exciting to see this program grow, and then simultaneously seeing other needs in the profession. So we are starting to work on research and development of other evidence-based programming to support the well-being of the profession. So stay on the lookout for other programs and resources out there for you all, no matter what your area of the profession or life stage in your career might be. I also am a researcher. So I'm on the research team for the Merck Wellbeing study. So you might see a few slides in here from our research over the past year from the Merck Animal Health Veterinary Wellbeing study. That was such a huge honor to be involved in that study. And then all of this, and also I try to have a life outside of vet med too, which is really, really hard to do, especially when you're growing something completely new out of the ground and trying to stay connected. So a few of my hobbies, I love soap making. So that was a pandemic hobby that I started getting into. Time with family is very important to me. I occasionally meditate. I used to meditate a lot more during the start of the pandemic. That was really helpful for me. I've kind of trickled off a little bit. This is on the lower left is a climbing wall I built in my attic. So that was kind of a fun project. I enjoy woodworking, and so built a climbing wall that I can still use, and it's really fun, and also love music, and then hikes with my greyhound. So try to maintain that personal identity outside of vet med, because I think oftentimes in this profession, our identities as people get so tightly interwoven with who we are as vets that sometimes when this career lets us down, we don't have a lot else outside of the profession. So I try to make a really intentional effort to stay connected at least a little bit to some of the personal hobbies or time with friends and family that I have to just help me stay going in this profession, because it can be really hard sometimes. So that being said, I want to get to know you all a little bit better too. So I'm going to ask you to open up your phone or a browser and go to menti.com. We're going to have a little audience participation because I want to get to know you all a little bit better. So menti.com. And use the code 37267137. I'll post that in the chat. So go to oh yeah, awesome, Carly's on it. So go to menti.com, use the code 3726737. That's a mouthful of numbers. So go there, answer the question. I hope it is working. We'll see. There we go. So I wanted to see what your current role is in vet med, to see where we're at here. So we've got, all right, some veterinary students in the audience. Hello, veterinary students, fellow early career vet. Early career, I don't know, less than 10 years out, 5 to 10 years out is what I would consider early career. Not working. All right, great. And yeah, you're welcome to post in the chat as well. Good. And while you all are answering this, I'm going to answer a question that came up in the chat at the start. So some tips on how to find a good therapist that can target veterinary medicine issues. One recommendation is to Google veterinary social workers. So to see if there's a veterinary social worker in your state. With the increase in teletherapy, often if you can just find somebody in your state, it doesn't even matter if it's in the same city, but you can connect with someone. I know a few amazing social workers in North Carolina, So that would be one recommendation, is just to Google veterinary social workers, because they have typically have some type of experience or training in the veterinary profession. I think it does help to have a mental health professional that kind of understands the field a little bit, so that you're not spending a lot of your appointment explaining why you're experiencing stress. So that would be one recommendation. All right, I'm getting a lot in the chat too. All right, mid to late. Okay, good. I'm just reading through. All right, we're going to go to the next one. So a lot of veterinary technicians, some veterinarians. I like the distribution here. That's a very cool bimodal distribution. All right. So the next slide is, all right. What do you enjoy doing outside of your life in vet med? So I showed some of my hobbies, and feel free to post in the chat as well. What do you enjoy doing in your life outside of your life in vet med? I'd love to hear some of your hobbies. Woo, hiking. I love to hike. Gardening, awesome. Family, drinking, singing, baking, horseback riding. We've got some equine people in the house. Crafts and awesome. Hiking with my dog. We got a lot of readers. And so the words that are bigger means that more people have answered that. So family, running, traveling, painting seems to be common answers. I love all of these. Volleyball, let's see some of the demolition derby. How cool is that? Man, that's a pretty cool hobby. Ballet, very cool. I like these hobbies. Live music, same. If you like live music, if you're the one who put that, post in the chat your favorite band. I'm just curious what your favorite band is. All right, y'all. Thank you. That's fantastic. We have one more so I can get to know you all a little bit better too. I want to know, are you a beach person or a mountain person? Just kind of a fun one. I'm definitely mountains. Right now, mountains are winning. Let's see. I just spent a couple of nights in near Corpus Christi, Texas on the beach there, and that was actually pretty pleasant. I would typically prefer mountains, although my favorite is when mountains meet the beach, like in the Pacific Northwest. When we went to Vancouver Island, just huge mountains and beautiful beaches. All right, so it looks like we've got mountain people in the house. Okay, well, thank you all for participating. We're gonna have a few other opportunities for engagement throughout the presentation, just hopefully help keep things interesting. I know that these things these webinars can get a little boring sometimes, so we're going to try to keep things spicy as we go forward. Okay. So let me hop back over to the presentation here. All right, so what are you going to learn tonight from me? My hope is that at the end of this hour together, you'll be able to discuss some of the research on burnout within vet med, including what is the incidence of this, how often is this occurring, and what are some of the causes that we're seeing. I want you to be able to recognize symptoms of burnout within yourself or within others, your mentees, and then discuss some individual and organizational strategies that you can use as a mentor to mitigate burnout within the profession. So over the next hour, we're going to give you a definition of burnout. What exactly is this? What are the symptoms? Causes of burnout, both in veterinary medicine or just in general, and then some research updates around burnout. And then we'll go into organizational or big picture strategies for practices or organizations, and then some individual strategies or things that you can do to support yourself, as well as some resources for you all. And so as we go through this, I really want you to think about what can you do about burnout today? So we're going to talk about a lot of different techniques. And so really honing in on maybe trying to just pick one or two things that you're going to take away from this presentation. So as you're kind of going through that, hone in on that message, and then also really starting to think about what exactly is burnout. And because we all, I think, hear that term frequently. So gaining a really deep understanding of what burnout is, I think, is important as we move forward as a profession. All right, so what is burnout? Burnout is, as I mentioned before, not an endpoint. It's not a end of the road. Burnout is a psychological syndrome that emerges as a prolonged response to chronic interpersonal stressors on the job. So this is a big way of saying chronic stress on the job left unchecked. So if you're not doing enough to manage your stress, can eventually lead to experiencing burnout. And in the vet profession, we do experience a lot of inherent stressors within our profession that are never going to go away. So over time, if that stress builds up, and you are either not eliminating your stressors or reducing your stressors, or coping with your stressors, or getting tools to reduce the stressors, or if there are preventable stressors, if you're not removing those, then that can eventually lead to burnout. And so what does burnout look like? So these are kind of the 3 hallmark symptoms of burnout that you need to look out for in yourself and others. So essentially, the first symptom is exhaustion. So when you are feeling, I remember when I was experiencing really severe burnout, I told my mom that I was feeling mentally, physically, and emotionally exhausted. I just felt depleted, loss of energy, that I was worn out. And typically this exhaustion can even start at the beginning of the workday. So you're already driving in, you're already exhausted before you've even started the day. The thought of another day of work is just exhausting. The other overwhelming exhaustion, exactly. Somebody mentioned in the chat, overwhelming exhaustion. The second symptom of burnout that's common is cynicism. So you might notice that you're feeling irritable, negative, indifferent, or having a distant attitude about your work, your patients, your clients. You may notice that you're feeling more cynical in general about your work as a veterinarian, and then wondering if the work that you're doing even matters. And that's kind of our last symptom is inefficacy. So essentially this means that you feel like you're ineffective, like the work that you're doing doesn't really matter, that you're not competent, or you are not having successful achievement at work. And again, in my point of burnout, it seemed like even though I was treating patients and even though I was helping animals, I didn't feel like I was making a difference to anyone or to anything or to any animal. Felt like anything that I did didn't matter. I didn't feel like it changed the outcome of anything. And looking back, obviously I was doing things to help animals and I was providing treatments, but in that moment, when you're experiencing pretty severe burnout, it doesn't feel like the work that you're doing matters. So what causes this? How will this arise? So typically, so before we get to what causes it, we should talk about also why this matters and what this kind of can result in. Burnout not only affects you personally, but it can also lead to a lot of other challenges. So it can lead to more medical errors. It can lower the quality of care that you're providing to your patients. It can lower your own well-being and physical health. It can lead to, in the workplace, employee turnover. And we're going to talk a little bit later about the financial costs of burnout to the profession. And it can also result in decreased productivity. So by experiencing burnout, we're actually also potentially having harming our patients or providing not as good of care as we could have provided if we weren't experiencing burnout. So this is some of the research that they've done in human medicine, and we do see that we might have some increased risk of these issues. So when we're looking at different causes of burnout, as I mentioned before, Stress is, and chronic stress is the precursor to burnout. So anything that can cause stress at work can potentially lead to burnout. We know within this profession, it's an inherently stressful profession. This profession, veterinarians in general have higher stress levels than the general population, our veterinary support staff as well. And so when we are experiencing inherent and regular sustained stress over time, that can compound and eventually lead to burnout. I think a lot of, and you all probably experience lots of different stressors throughout the day, but some of the ones that come to mind, things like conflict with your team, or being in a toxic work environment, or conflict with your clients or a boss, experiencing ethical dilemmas, sometimes paperwork or overwhelming demands, or maybe being on call, maybe not being able to get off of work on time, sustained long, grueling hours. All of these things are potential stressors, some of which are inherent, and we're never going to be able to make clients be nicer to us no matter how much we ask. We're always still going to have those clients that are going to yell at us, but maybe there are things that we can do to set better boundaries for ourselves, to maybe take a brief break during lunch. So some of these stressors are inherent and never going to go away, and then other stressors might be able to be managed. So we're going to talk a little bit about mitigating some of this burnout in the second half of this presentation. But when we look at burnout overall in general, some of the suggested causes are things like work overload. So that would be kind of the first one that comes to mind, right? If we're just working a lot of hours over time, that can eventually lead to our burnout, especially if we don't have any opportunity to rest and recover. It's interesting because even if we're not working 80 hours a week, we can still experience burnout. So I experienced burnout at 40 hours a week. I know people who've experienced burnout at 20 to 30 hours a week. So burnout can happen regardless of the amount of hours, but it also matters, when you're at work, is your workload too heavy? Do you feel like you're getting enough time to provide quality patient care? Do you feel strained because you're not able to provide the care that you think you should be able to because maybe you're short-staffed? So any kind of work overload is a potential cause for burnout. We also know that lack of control, so feeling like you don't have the ability to influence decisions affecting your work, or the ability to gain access to resources that you need to do an effective job. You may be again to feel like you don't have much control of your job and your career. And if you don't have much control of your schedule, that can also be frustrating, or your cases. The example I like to give here is that I hate cat dentals. I asked this question, and I would love to, if you love cat dentals, let's hear it in the chat. There's probably like 3 of you out there, but I hate cat dentals. I hate removing cat teeth. I know how to do it, but I just don't want to. Amanda, you love them. Wonderful. Keep doing you. We need more cat dentists in this planet. So I absolutely hate them. And fortunately, my mentor with my practice really didn't mind cat dentals. And so one day I go to him and I say, hey, doc, I don't want to do cat dentals anymore. Can I just do dog dentals? And you take the cat dentals. And he said, great, that sounds awesome. Let's do that. And so I took the dog dentals and I didn't do cat teeth anymore. And I, in that moment, felt like I had control over the cases that I saw, and I was supported in not doing something that stresses me out like a lot. And so being able to have that flexibility and control, if he had said, no, Addie, you need to continue learning how to do cat dentals and you're going to have to keep doing them, and that would make me feel a little out of control. Dr. Beth Newman also loves them, or Beth Newman. That's amazing. You all, so 2 people love it. All right. So we can also see burnout if we aren't getting enough recognition or reward from the work that you're doing. So if you're putting in a lot of hard work, but not really feeling like you are getting much reward out of that. Poor relationships at work. So if you're working in a workplace in an environment where there's a lot of conflict, and there's conflict maybe with your coworkers, Maybe it's just a toxic work environment in general. Perhaps it's an abusive environment that can contribute to burnout. When there's any kind of lack of fairness, so if you feel like there's decisions being made that are unfair or lacking respect, that can lead to feelings of cynicism, anger, or hostility. And then values conflict. So values are these ideas and motivations, our core values that originally kind of attracted you to do this work. And it can also be some of your personal values. So if you value family, if you value, say you value work-life balance. So if you're in a job where there's a gap between what your values are as an individual and what the organization values, then it might feel like you're sacrificing the work that you want to do for the work that you're required to do. And if you're having to do things that go in your day-to-day against your personal and professional values, that can also lead to burnout. So for thinking of an example of this, I worked in rural Kentucky, right? So we provided affordable care to a lot of our clients. I valued being able to provide accessible and affordable care to my clients, and that aligned with my workplace. So we were on the same page of we might have to work a little bit harder and a little bit more efficiently to provide this care at an affordable rate for our clients. If I was a person who valued all the bells and the whistles and all the top tier diagnostic testing and wanting to get to a definitive diagnosis and digging and digging and digging and doing all the diagnostic tests and providing the gold standard care all the time, I'm probably not going to be happy working in rural Kentucky. And so that's a values mismatch. I might be more happy working in specialty practice or at a veterinary school where I actually can practice gold standard more frequently. So those kinds of values mismatches can lead to burnout over time. And those are harder to resolve. And so I definitely recommend, as you're looking into a job or as you're helping a mentee find a job, make sure you help them figure out what are their values or what are your values, what are the values of the place that you're interviewing at, and making sure that those align so that you can get in a situation where you're setting yourself up for success. Rural Kentucky is the very, very best, says somebody in the chat. Totally agree. All right. And so this kind of pulls some of this together. So there's different drivers for burnout. So there's different drivers that can lead to burnout, but then there's also drivers that can lead to more engagement and satisfaction in your work. So this was a model presented on burnout. So being able to have meaning in your work, the workload and job demands, control and flexibility, work-life integration, social support and community at work, organizational culture and values, and then efficiency and resources. So in situations where those things are not optimal, it can lead to burnout. In situations where those things are more optimal, it can lead to feeling more engaged in your workplace, a sense of vigor, a sense of dedication, being absorbed into your work. So this is kind of some of the drivers of burnout. All right. Somebody said, maybe that's why you didn't like Cat Dental's good quality equipment and instruments make a difference. Yeah, we actually did have a pretty quality dental setup in our rural Kentucky practice, surprisingly. All right, so we're gonna flip back over. We just talked about a lot of different causes of burnout, but I wanna hear from you all, make sure that you are learning from me. So what are some potential causes of burnout? Would love to hear, just list one in your answer. So what are some potential causes of burnout? What is work-life integration? Good question, Courtney. So work-life integration is essentially, so if you think about work-life balance and what balance means that there's some kind of like 50-50, like we're maintaining this perfect balance between our work and our home life. And for me, that's not really possible. For me, my work and my life are integrated into one. So sometimes I have to, at work, take a personal call and I have to make a doctor's appointment. And then sometimes at home, I might have to catch up on charts. And so work-life integration is finding kind of your sweet spot of how you can both integrate your work and your life in a way that's healthy for you and successful. I also like to call it my work-life rhythm. And so sometimes my work is more consuming overall in my life. And then sometimes it can swing back to personal life and I can prioritize that more. And especially if there's things going on with my personal family, like if there's a sickness in the family or something serious, and maybe I swing back over to personal life. So having this rhythm of, being able to integrate the two successfully together, it is so challenging to do any of those things. And it is a constant work in progress. And it is something that always having that awareness of, am I giving too much of myself? Do I need to take a step back? And I even still, after having experienced burnout twice, I slip up and make mistakes, and sometimes I overcommit, and then I have to take a step back and say, okay, I took on too much. And then, but it's a constant roller coaster throughout our career of trying to find this harmony in both our work life and our personal life. All right, let's see from the chat. Overworked, poor management, toxic relationships, lack of communication, overworking, no work-life balance, no lunch breaks, working too many hours. Good. A lot of death and dying. That's a sad part of our work. All right. Thank you all for participating in that. And so we're going to hop back over to our presentation here. Okay. So let's talk about a little bit of research regarding burnout, and then the second half of this presentation is going to be all about solutions. So some research updates relevant to the veterinary profession of kind of research over the past 5 years. We are seeing about moderate to substantial burnout symptoms in about half of veterinarians. And that was consistent in research, in multiple research studies. So half of respondents classified as having high burnout scores. Over half of veterinary technicians are experiencing burnout, higher rates of burnout than physicians, despite fewer hours worked for our veterinarians. So that's just, I don't like to compare. I don't ever want to be a human doctor. That sounds like a horrible job. But the reason I put that point on there is that even not working as long of hours as physicians typically do, we still have high rates of burnout within the veterinary profession, despite physicians working on average more hours than veterinarians. So it's just showing that highlight of you don't have to work 89 or 90 hours a week to be burnt out. This is some of the research that we recently did over the past year with the Merck Wellbeing study, showing the rates of burnout in both veterinarians as well as the veterinary support staff. And so for our veterinarians, as you see, we have over 50% of vets that are experiencing moderate to high levels of burnout. For our support staff, this might be even worse. So around 75% of our support staff might be experiencing moderate to severe burnout. And as you can see on that graph, about half of our veterinary support staff may be experiencing high levels of burnout, which is concerning. We also know that burnout seems to improve as age increases. So our youngest veterinarians seem to have higher risks of burnout. So for the youngest group of veterinarians, our new and recent grads, less than 5 years out, seem to have around 75% of them are experiencing moderate to severe burnout. And as age increases, burnout measures also increase over time. This is not unique specifically to the veterinary profession. In general, when we're looking at mental health, it does tend to, for the most part, improve as you age. And there's a lot of factors that go into that. But we do see that the youngest vets do have highest levels of burnout among veterinarians. And when we looked in the Wellbeing study at why does burnout occur, so some of the factors that cause it are having a more chaotic work environment. So if respondents on the survey classify their work environment as more chaotic versus calm, the more chaotic work environment tended to result in higher burnout. Doesn't sound like a huge surprise, right? Individuals with less control also tended to have higher levels of burnout. And then more hours, so more hours worked, also tended to result in higher levels of burnout. And somebody mentioned, is this because the veterinarians that burn out at a young age leave the field? No, there is a lot of factors that go into early career, high levels of burnout in the early career, but typically that the vets leaving the field is not a driving factor on the well-being increasing with age, but it is a good question. Typically, we see well-being improving as we go 5 to 10 years out. And a lot of it just has to do with comfort level with medicine and feeling more confident as they go on in their careers. But our youngest veterinarians do seem to have a little bit more stress around providing care along a spectrum and really adapting to that transition from veterinary school to clinical practice and the responsibility that comes with that as well. Additional stressors, so shortage of veterinary staff is another stressor that we're experiencing, inefficiencies and staff turnover. So turnover just means that people are leaving and potentially going to a different hospital. So for veterinarians, 15 to 17% turnover rate, and for veterinary technicians, around a 25% turnover rate. So that turnover rate is also creating stressors on the team, which I'm sure that you all have experienced and felt in your practices as well. And then this has an impact on the entire industry. So there was a study that came out very recently that showed that our industry on average loses around $1 billion a year in annual revenue because of burnout within the veterinary profession. So this is substantial impact on our overall industry as well. So what are we going to do about it? This feels like a big problem. I think that we know in general that burnout is not unique specifically to veterinarians. We do know that veterinarians do have higher levels of burnout than the general population, but we do also know that other careers experience burnout as well. But fortunately, there are methods that we can use to reduce our levels of burnout, both within ourselves and others. So when we're looking at organizational strategies, so these are things that you can do if you are in a leadership role within an organization. So if you're working in a practice and you have the ability to implement some changes, these are going to be some suggestions. If you're a mentor that has that ability to make some of these changes, for you to pay close attention to how you can better support your team or your mentees and your environment. So some of the organizational strategies that you might consider are things like acknowledging and assessing the problem. So just the simple acknowledgement that this is present in our clinic, assessing how bad the issue is, and then starting to implement some targeted interventions, building workplace community, strengthening your work culture, and then promoting flexibility and work-life integration. We're going to break down a few of these and give you some more specific tips on things that you can do within your workplace. First and foremost, for anyone who's interested in kind of gauging your own levels of burnout, or if you want to give this resource to your team, the AVMA has a ProQual assessment. So this is going to measure both your burnout levels and your compassion fatigue levels. And so that'll give you an idea of where you're at currently. You can give this resource to your team and say, hey, like check this and see how you're doing. And so just really acknowledging and assessing where you're at with the issue. I typically like to take this test every 6 to 12 months so that I can kind of track where my burnout levels are at. So you can just Google AVMA and then ProQual, PROQOL, and it's an online free tool for you to use. So when we're thinking about in the workplace, how to create things for our mentees or create things for our employees to reduce burnout, it's helpful to talk to your team. So have a team meeting, talk about what are some of the challenges here? What factors are causing stress? Are there changes that we can make to address those stressors, right? Are there some things that we can do to reduce certain stressors? And again, work to identify one or two of the greatest concerns on the team, and then try to make some kind of plan to address that concern. I recommend starting really small so that you actually can make the change, but really starting to talk more with your team about what is causing us stress here in the workplace and what can we do about it. And hopefully as a team coming up with solutions together to reduce some of these stressors that the team is experiencing. What are things that we can do about right now to reduce this stress? And then building workplace community. So things like instituting structures for peer support, creating structured mentorship within your practice, providing opportunities for regular debriefing or one-on-one meetings with mentees to discuss tough work situations. There was a really fascinating study that was done in human med, and essentially physicians signed up for going essentially out to a meal, a shared meal together. So 6 to 7 colleagues going out, sharing a meal together at a restaurant once every 2 weeks. At the first 20 minutes of going out to eat, they talked about the shared challenges of being a physician. And just this, meeting every 2 weeks, going out to lunch, getting away from the practice, and then spending 20 minutes at the start of that lunch, just being able to share some of the challenges that they were experiencing, led to an improvement in both feeling that sense of meaning in the work that they were doing and an improvement in burnout. So again, these interventions that you're doing don't have to be large to start. Just start with something small that everyone kind of agrees on, and really hopefully starting to create some changes. And once you start creating small changes, then it snowballs so that you can make more and more changes. All right. And veterinary mentoring is really important at reducing burnout. We see with the research with our mentorship program, which we'll show a little bit later, that providing mentorship and support really does have the potential to reduce burnout, especially if it's positive mentorship. So mentoring is a relationship between vets. It's typically mutually beneficial. So I typically gain as much from my mentees as they gain from me. Really important during transitions, and it's built on this foundation of respect and trust. And a good mentor is somebody who's available and willing to answer questions, somebody that's going to be an advocate for their mentee, someone that's supportive and trusting of new graduates' medical knowledge and empathetic to the challenges that they're facing. And a great mentor is somebody who is able to recognize and respond to mental health challenges. So starting to think about what can you learn more as a mentor about mental health in the profession. This is a good step, a good start. So learning more about burnout, but doing things like QPR training is one that if you are associated with the veterinary profession, AVMA offers free QPR suicide prevention training to anyone within the veterinary profession. You don't have to be an AVMA member. So I definitely encourage you to do QPR suicide prevention training. It only takes an hour. Actively listening and providing feedback, assisting your mentees in those tough gray areas, ethical dilemmas, and conflict management, creating safety and inclusion, and then encouraging and modeling good self-care habits. So these are some of the things that you can do as a mentor to really create an environment of support for your mentees. And I would encourage you to either take a picture of this, screenshot it, something. I really love this debriefing tool. So this tool was created by the University of Tennessee Veterinary Social Work Department. And essentially it goes through a series of questions that you can ask. You can either journal about these, you can ask your mentee these questions. So some of my mentees I'll meet with and I'll say, you know, has there been some cases that have really been bothering you, that's been making it hard to sleep or put aside thoughts of work when at home? And then they'll usually tell me a story. And then I'll say, well, what did you do well in that situation? And what do you wish you had done differently? And move down the list and ask them each question and really help them debrief about tough work situations that they're experiencing. So I think this can be a really helpful tool for any mentor out there, for both yourself and for others. I gave these questions to my mom and I said, Mom, on the way home from work, if I've had a really hard day, please just ask these questions to me. So I would really recommend using this tool in your practices. You can also use it in well-being rounds. So you could break everyone up into groups of 2 and have each other ask those questions in those groups of 2, and take, 15 minutes every week or 2 to do this. So again, these steps don't have to be big overhaul things that we can do. They can be very small steps that we can do in our workplace to make a big impact. Other things that we can do, strengthening the workplace culture. So doing things like team building, having candid and open communication on the team, creating an environment of safety and inclusivity. Would definitely recommend learning more about how to create inclusive work environments. Look up Journey for Teams, which is an AVMA program on inclusion in the workplace, as well as Blend is another one that is doing kind of workplace education on DEI topics, and then psychological safety. So creating an environment where mistakes are viewed as a learning experience versus we're going to get yelled at if a mistake was made. Because often I know if I get yelled at when a mistake is made, I'm going to be a lot less likely to bring up a mistake in the future. And so it leads to worse patient care and hidden mistakes, which then can really harm patients. So creating an environment where we're not necessarily celebrating mistakes, but we're acknowledging that we're human and mistakes happen, and being able to learn from those mistakes as a team, and creating structures so where that mistake won't happen again. All right, so promoting flexibility and work-life integration. So flexibility on work time and length of shifts. So allowing your people some flexibility, vacation benefits, and coverage for life events. And then some individual strategies. So these are things that you can do yourself as well as support your mentee through. So thinking about, and we'll go through each one of these, but changing your work patterns, setting healthy boundaries for yourself, developing good coping skills, getting social support from others, doing good self-care, and then counseling or therapy. So encourage your mentees to take a quick lunch break, encourage taking vacation time, and do that yourself. So take 10 minutes out of your day, or even 5 minutes. If you can even take a short break, you're going to be more productive than when you left, or if you had just worked through your break. And it actually results in a net positive benefit, even if you just take 10 minutes of time. Boundary setting. So help your mentees set healthy boundaries for themselves. How comfortable are your mentees speaking up about their needs? So creating safe spaces where your mentees feel like their boundaries will be supported, and encourage them to vocalize their needs within the workplace. Really start to ask your mentees what training and skills they could develop to decrease some of the stressors that they might be facing. So maybe that means encouraging them to attend something like a veterinary leadership conference. So AVMA does a veterinary leadership conference in Chicago once a year. That's one of my favorites because it really gives you a lot of tools on some of these professional skills on how to cope with some of these difficult client interactions or conflict, ethics and leadership. Or encourage or go to a workshop on conflict management and really hone those skills on conflict management. Ask your mentee who's helped them through tough moments before in their life, and make sure that they're reaching out to friends and loved ones for support. And if they don't have a strong support network, ask them how they might start building their support network. And encourage your mentee to practice regular self-care. So modeling healthy self-care habits as well. So your mentee knows that it's okay to take time for themselves, and encourage recreation and hobbies. And then finally, counseling or therapy. So finding, I think somebody mentioned in the beginning, being able to find a therapist who maybe has a little bit of experience working with veterinarians or other healthcare providers can be very helpful in instances of burnout, just to give you some more individualized tools that are specific to you and your scenario can be really helpful. So we're having to redefine, I love this quote. So when we're thinking about self-care, we're having to redefine what's the ethical responsibility. That includes not just working really hard, but also keeping oneself well so that you can continue in the work and help with the other people in the profession or in your clinics. And so thinking about as you go forward in your career, prioritizing yourself is just as important as all the other things that you do, because if we're not able to take care of ourselves, we're not going to be able to have the energy to take care of others and their pets. And a lot of this goes back to being able to vocalize your needs and set healthy boundaries for yourself. And for self-care specifically, being able to take little micro moments of time. So we're very busy as veterinary professionals. And one way to look at your self-care is micro moments. So these are brief periods of self-care. So for example, if you've had a particularly challenging client interaction, giving yourself 30 seconds to just sit and take some deep breaths, or just take 2 minutes to get some fresh air outside. So self-care doesn't have to be large to be effective, but it should be consistent. And it is hard to practice self-care, but it's a constant process of self-reflection on what areas am I doing well in? So am I getting enough sleep? Am I eating well? Am I exercising? I can tell you right now, my exercise has kind of gone out the window. And so that's probably an area that I could work on again. So just being able to really reflect on those aspects. And then of course, counseling or therapy. So we're going to pop back over to our poll, and we're almost done. So I want to hear from you all. What is one action you can take to reduce burnout within veterinary medicine? So what is one action that you can take to reduce burnout within veterinary medicine? Be kind and talking with peers. Good. I love peer support. Being able to talk to people who are going through very similar situations can be very helpful when you're dealing with the stressors of veterinary medicine. Setting boundaries, showing compassion, taking breaks, debriefing with a coworker on a regular basis. Love it. Supporting coworkers, putting yourself first. Great. Going to the gym, communicating with others and be understanding, checking in on coworkers, exercising. Good. All right. These are all fantastic. Knowing your limits. Good. Okay. We're hopping back over to the presentation. Got a few more slides left, and then we'll have a few minutes for questions. So some resources that are available to you all. I would encourage you to check out avma.org/wellbeing for some resources on well-being. I would also mention the Veterinary Leadership Conference. So that's a good one for learning some of these professional skills. The Veterinary Mental Health Initiative is also provides free peer support for both veterinarians, I think, as well as veterinary technicians. Again, it's usually 6 weeks of peer groups. And so it allows you these safe spaces to talk about the challenges you might be facing and gives you some tools. They also have free one-on-ones with a psychologist. It might not be therapy, but it is still it's a mental health professional that can provide you with resources and support for your mental health. And then if you're a book person, so the A to Z self-care handbook for social workers or other helping professionals, as well as coping with stress and burnout as a veterinarian. So just a few resources to get you started as you go forward with your well-being journey. And then wanted to also talk a little bit about MentorVet and kind of the intervention that we've developed, because this is definitely targeted at reducing and preventing burnout. And so within our program, we have 5 learning modules in self-care, leadership, and conflict management, ethical decision-making, and how to provide care given limited client finances. So all the kind of key stressors for our youngest veterinarians. And once a month, we meet on Zoom in peer groups where we can really create those safe spaces to talk about some of these shared challenges that we're experiencing. The program does offer 10 RACE-approved CE credits, and we have a lot of optional resources like pairing with a mentor, mental health coaching sessions, and financial coaching sessions, which is included in the cost of the program. So if you know of any early career vets who have graduated within the past 5 years, we'd love to have them as part of our community. If you are a veterinarian and are interested in getting involved and engaged and becoming a mentor, visit our website, and we're always looking for great mentors. So you can go to mentorvet.net is our website, mentorvet.net. And so if you want to get engaged in our community, we have a lot of ongoing training and development for mentors, not unlike the talk that we did today. So we offer a lot of free training for our mentors. And then if you're not in that category of young vet or vet that wants to help and be a mentor, stay on the lookout. I would encourage you to go to our website and stay in touch with what we're doing, because we're going to be starting to make a lot of new programs over the next year. So be on the lookout for programs that might fit your category. And the research that we've collected is that this is really helping with reduction of burnout. So in the pilot, we looked at cynicism and exhaustion, which again are 2 measures of burnout. And for our MentorVet participants, those measures slightly decreased over time. For other new grads, those measures significantly increased over time. So what we were seeing is that this program had the potential to prevent some of this early career burnout. In our fall program evaluation, MentorVet participants had lower levels of burnout than our control group, as well as higher levels of feeling like they had a healthy method for dealing with stress. Over 95% of veterinarians, 94% of veterinarians who went through our program felt like they had a healthy method for dealing with stress in their life after the program, compared to the control group, which was only around 65%. So that being said, we're going to end on one last question for y'all. What was one big takeaway that you had from our time together? So take a minute and think about what was one big takeaway that you had from our time together. And then we'll wrap up and give you all the CE link so that you can get your credit for CE. And then I will also stick around for any questions. There are resources available. Yes. I need to make time for myself. I need to make more time for myself too. It is a work in progress. Managing stress, more self-care and boundaries. There are counselors for vet professionals, debriefs, and asking for help. Good. Self-care is important, and taking little micro moments of time. Monitoring signs within yourself, prioritizing yourself so you can take care of others, and taking time for yourself to make sure we're not taking too big of a workload. Good. And being kind to ourselves. These are fantastic takeaways. Thank you all so much for engaging. And if you're on the Mentimeter and you're interested in receiving MentorVet's newsletter, monthly newsletter, so well-being and mentoring tips, we don't spam people. I'm not into that. So right now we have one email a month to just update people on what we've got going on in our community, providing resources. So if you're interested, definitely let us know what your email is so that we can keep you updated on what's going on within our community. If you want to be added to the newsletter and you're not on Menti, you can send me a private message in the chat with your email address and I can add you to our mailing list. But I definitely would encourage you to stay on that mailing list to stay updated with some of the resources and support that we have available in our community. So thank you all very much for taking the time today to learn a little bit more about burnout. I do truly believe that this is an issue that we can address together. And I think that if we take steps to take care of both ourselves and others within the profession, we are truly going to create a healthier veterinary profession going forward. If you have any final questions that I don't get to tonight, don't hesitate to send me an email. You can send it to info@mentorvet.net. You can visit our website. I would also encourage you to follow us on social media. So we're on all the social medias. So if you're a Facebook person, we're on Facebook. If you're on LinkedIn, we're on LinkedIn. If you're on Insta, we're on Insta. So look for MentorVet on any of those social channels to stay up to date on what we're doing within the MentorVet community on evidence-based intervention.